okay? Okay, so we're going to run a little, so first I'm Todd Mansfield, I'm one of the owners of CoreLife, and I welcome you, thank you for coming. This lecture will be live streamed, so there is the possibility that you may be on the live stream. If you don't want to be on it, because our other room is full right now. I just want you to know that. If you were to start when you came in, you may leave, if you know what I mean. So welcome. We're very happy to have Dr. Stram with us today. He's really brought here by Margaret and her group. So Margaret, thank you. And Margaret is from Southern Tier Lyme Support, Inc. They have all of their information out front. Margaret was a friend of mine from high school. It's really, really weird that 30 or 40 years later, or however, a long time ago, look, we can say whatever you like. So I'm just going to go ahead and pass the mic on for questions at the end. We're going to have handouts that are going to come across to you. So that if you want to ask questions, please feel free. You can come and listen. There's another chair. Margaret, I'm just going to pull chairs up there. Yep. So if you have questions, if you just write your question down, and at the last 10 or 15 minutes, Dr. Stram will get the questions and we'll read them so that people that are live streaming can hear them, and we'll go from there. Okay, and if any questions along the way, Dr. Stram will take it. Okay, anything? We're all set? Okay, off we go. Nate, you good?
All right.
Okay.
Well, thank you so much, Todd, and it is really a pleasure to be here. What a great facility, and really amazing to see that. So, this is foresight and entrepreneurial stuff going right here with Todd, and certainly the Southern Tier Lyme Support, Inc., the Support Association with the Maggies. We are really so grateful that they invited me. So the topic is Lyme disease and diet and what you need to know. But first, I'm going to just kind of tell you who I am. And who I am is I'm a regularly trained doc. I went to medical school in New York City at Mount Sinai, and my training is in emergency medicine. And through that, I was emergency room doc for about 25 years. And I got a kind of firsthand view of what we do well in medicine. What we do well in medicine, I believe, is really acute care medicine. We're really good at heart attacks, strokes, bad accidents, really ingenious operations that can help people. What we don't do that well in is the chronic conditions that plague a lot of people, be it diabetes, high blood pressure, heart disease, chronic pain syndromes. We don't do that well. So about 15, 16 years ago, I established the Stram Center for Integrative Medicine, and it is a collaborative practice. It is an investigative practice, because it's my belief that a pill for every ill doesn't always help and get to the why. Why do you have it? What's the reason? And what we found is by combining these therapeutic modalities, be it Chinese medicine, nutrition, physical exercise, meditation, yoga, naturopathic medicine, homeopathy, herbal medicine, that together more minds make up a better community of practitioners than a single person. This is really neat. I really kind of like this. It's just like, wow, okay. So like I could go back to my face. Well, what a nice guy. He looks good. Okay, but I'm going to go this way. Okay. So Immune System 101, and why I'm going to talk about the Immune System 101 is really what I think is so significant. And really that is the major focus. Probably about 60% of this lecture is just to try to get you to understand how important the immune system and how a place like this interacts with the immune system. Lyme disease is a pretty complex, crazy disease. It is unfortunately a political disease, which I will not talk about, because we're here to say it is a problem. We know it's a problem. You all wouldn't be here. You wouldn't have sold out this twice if it wasn't a problem. So we hope to at least give you information that you can take home and use today. and then to look at really how diet and the gut health are there for your rescue. Because what I do believe is that food is either your best medicine or your slowest poison. What we see here is food is your best medicine. And that there are supplements that you can take that you don't need a prescription for, that you can take on your own that may be helpful. And then we have what we have developed through our practice. And again, this is through the collaborative nature of our practice, what's called a Lyme map. So that at the end, you'll see a very complex picture of how we sort of go through things and really, hopefully, can address many of the individual cases that you may have. So the immune system. Well, the immune system is made up of a network of cells that work together in concert to really help the body rid itself of foreign invaders. And in fact, the gut is the epicenter. But other areas are the spleen, the lymph nodes, the thymus, which actually sort of goes away or gets very small as you get older. But the gut is the major epicenter. In fact, 70% of all your immune function really comes from the gut. Now, what's interesting is you've heard of the gut brain. So what's interesting is that the gut itself is also the second highest level of nerves. First is your brain, the second is your gut. So when you say, I don't know, I have this gut feeling, it's true. I mean, it's actually a true statement that the gut is the epicenter not only for your immunology, but it also could be a secondary information center for what your brain wants. So there are two different types of immunity. There's the innate immunity and acquired immunity. The innate immunity, I'd like to say, those are kind of like the enlisted men. Those are the guys that they're like the army that comes in, and they really they're not given like specific orders to attack something. They're just ready to attack. The good news is that they're there right away. So you've seen this on your blood count. You may have gotten a CBC, a complete blood count, one time, and you see neutrophils and maybe mast cells and eosinophils. So those are the guys that come around and kind of eat up the things that look like foreign. Now, that's good news. But they're also sometimes they act like thugs. So sometimes they're not even sure if you're a bad guy or a good guy. So sometimes they eat at you even when they are incorrect. And some of the diseases that people have, like irritable bowel, rheumatoid arthritis, and something that Lyme disease, may be affected by that immunity. So that's the innate, meaning it's there. You don't need any information. Well, the acquired, those guys, they're like the special forces. So those are like the special ops. They need time. They need information. And for those guys, it can take anywhere from weeks to months to develop their system of immunity. And they are typically handled by the lymphocytes. So those are the T and the B cells. With them, they have one specific directive. So they're there to, let's say, fight a specific infection. That's the only goal that they have. They don't work for another goal. They only work for that specific goal. So we're going to hopefully tie that all in. So the key players, though, in this system is the microbiome and the immune cells that I just spoke about. Now, the microbiome, has anyone heard of the microbiome?
Yes.
So the microbiome is actually an unbelievably interesting concept. Now, it may be the hottest topic in medicine right now. And it was a Dr. Jeffrey Gordon out of the University of Washington. Amazing guy, actually. He's been doing this for 20 years, that recognized the effect of the microbiome on us as a system. So what does that mean? Well, the microbiome is bacteria, viruses, and mostly it's bacteria, but also some fungi that house your body. And in fact, when you look at it, our body is this cup. What's in it are the microbes. So that even though we have about maybe 5 or 10 trillion cells in our body, we have about 100 to 150 trillion microbes. most of those microbes are really beneficial for our functioning. And we know that specifically by the work of Dr. Gordon, which he's done some amazing work. Some of the work he's done, and some of you may be animal activists and may think unkindly of people that use animals to do studies, but this is a pretty important study. He used a mouse model, and it's called a gnotobiotic model. Gnotobiotic means it doesn't have any bacteria in it, or at least the only bacteria that it has are ones that it knows. So this type of mouse is really helpful because it is a completely sterile organism. It's completely sterile. And one would think, well, if it's completely sterile, it must be really like strong and tough and really like great at everything. Well, actually it's not. In fact, it's a very fragile animal. It breaks its bones easily. It has a very pure immune system. And so one can kind of maybe get an idea that maybe there is an interplay between these guys. So what's interesting is that this is a pretty complex looking picture, but I really want to kind of get at some of what it is. This is the secondary immune response. So the secondary immune response, now this is all part of your microbiome, and I'm trying to kind of put this together. But you've got some foreign invader that, let's say, you eat, you know? Let's say food poisoning. Not that you would ever get that here. Never. Like, right. But let's say, like, you went to some other place, like, and I won't say anything, buffet of some sort, of something like that. And maybe like a bar mitzvah or a wedding, because we're going to take it away from this. And you know, within maybe 3-4 hours of eating, the antigens presented. Now, within 3 to 4 hours, the volume of bacteria is tremendous because its doubling time can be anywhere from 5 to 10 minutes. It'll double in population. Now, that's good to remember because we're going to talk about Lyme disease, and Lyme is exactly opposite. So it is very quick to tell your body there is a problem. We got to do something. We got to try to house it. Let's create an inflammatory response. Let's take this antigen, put it on to one of the cells here so that we know what it is. Let's try to remember it. Let's get these T cells. So these T cells, one of them actually tries to kill the bacteria. And the other one, well, it sees the other bacteria that's already invaded into your cell. So it tries to kill that one. And together they kind of then now form these cells. They get onto these B cells, which then raise antibodies to this infection, so that in the future, your body says, wait, I've seen that before. We know you. We're not going to let you get us sick. So that's how vaccines were made, so that this way the antibodies are already in your system. So we already know how to fight them. Now let's say we're eating some gluten, some stuff that may be highly allergenic. Now, that doesn't really, you don't eat it like in quantities. Well, you can, but still not the quantities that you're going to reproduce it by 1 million or billion-fold. So you'll just have this sort of protein that's in there. So it does the same thing, but it never really overwhelms the system. It just sort of says, yeah, I think that there is a foreign body here, but not enough that we're going to really go after it. So it never really tells the stormtroopers that you got a problem. But the other guys that just look at, you know, the thugs, they see that, you know, your cell has been infected with this, or it has this protein on it that looks foreign. They think it still looks foreign, so they start eating at it. Well, they may get eaten at it by your intestinal walls. So that's the thought of why irritable bowel disease may occur, or rheumatoid arthritis, because of these circulating immune complexes. Not enough that they cause an acute response, just enough that they cause you symptoms. So this is your intestines. Now remember I talked to you about that mouse that was sterile. So that mouse that was sterile, these guys, which are the Peyer's patches, these are the guys that make your lymphoid tissues. This is where 70% of all your immunity comes from. Their Peyer's patches, they are 1/10 of that size. They are not all over the intestines. And because of that, what they note is that the tight junctions that don't allow bad stuff to come in are very loose. So they are really incompetent and immunosuppressed because they don't have bacteria. Because the point of this mucosal barrier is to maintain the integrity of the barrier, to really keep it tight so it doesn't allow for foreign invaders to come in, to regulate appropriate colonization, which means that you want to make sure that it's there, it's tight, it's being fed, which means there are foods that will help it grow and make it diverse and happy, and there are foods that will actually do the opposite. You want it to activate intestinal immune defenses, and you want to have a moderate inflammatory response. So when you had that food that caused you food poisoning, you want an inflammatory defense that gets everything out, either this way or that way, right? You just want it to get out. So you need an inflammatory response. So this idea of inflammation all being bad, well, that's not necessarily such a great thing. So if you shut all inflammation down, then you're shutting down part of your immune system. So this is how everything is connected. Really, so chronic persistent diseases, diabetes, high blood pressure, heart disease, medications, and we'll talk a little bit about medications, and the medicalization of diseases, the microbiome, which food either helps to support it in its diverse way or really reduce its effectiveness. And everything is tied to your immune system. So really interesting. When we look at babies being born, those babies that are born by cesarean section, which don't go through the vaginal canal, they actually don't get populated by a lot of the diverse bacteria that are healthy. And some of the diverse bacteria that are healthy that we know support sort of a good, balanced gut flora, like bifidobacteria and lactobacillus. They favor Enterococcus and Clostridium and E. coli coliforms just by the nature of their birth. Now, we have a very high rate of cesarean sections in this country. And when you look at it, what are also the other concepts that reduce this growth? Well, antibiotics are up there as number one. So antibiotics are very problematic for the gut flora, and especially if they are given non-judiciously, without the idea that this microbiome is so important. Because what they can do is they can indiscriminately kill the bacteria that are also there to help you. And by doing this, really disrupt your ability to fight an infection secondarily. So remember I talked to you about this mouse. Well, I'm going to now talk to you about another mouse. This is just a regular mouse. But this mouse, he was given just skin flora, just natural skin flora, and they isolated it specifically for yeast. Now, typically, that skin flora on this mouse does nothing, just like it does nothing on us. But this mouse was given an antibiotic. And the antibiotic was given to this mouse, and guess what happened? The mouse developed a yeast infection, similar to some of you who may have gotten antibiotics and developed yeast infections. And in fact, this same mouse, when given the antibiotic, when given the yeast by aerosolized form, in other words, by the mouth, got a pneumonia. So your mucosa is tied from here to your lungs, all the way down into your intestines and beyond. The other is the use of H2 blockers. Now I'm going to tell you, when I was growing up, I don't really remember H2 blockers or Nexium, the little purple pill. What a great purple pill, right? It's really nice. I like the color. It really makes you feel like it's going to save you. It's going to help you. What we were told is, take some Tums. And I remember, I was growing up and my teacher, because I would come back from the lunchroom, and I thought it was just because she was being nice, and I would eat this, hamburger, and it was fries, and I'd have indigestion, but I'd be really rowdy in class, and she'd go and give me some chalk. So I thought that was really nice, but I don't think it was that way. But calcium carbonate is really Tums. That's what it is, it's chalk. But H2 blockers, they're a dangerous drug, but they're kind of like candy. In fact, they're a $20 billion industry. And there's a real problem with them. Why? Because they not only disrupt your pH, the acid concentration of your gut, which makes it much less likely for you to absorb your foods properly. In fact, B12 deficiency, vitamin D deficiency, calcium deficiency, and specifically magnesium deficiency can be related to H2 blocker use and or proton pump use. Proton pumps are actually even worse because they're longer acting and they cause a much more significant role on the gut. Now, what does this do to your intestines? Well, it also does some other stuff, because since it changes the pH, the acid environment of your stomach. Remember those gut flora that we talked about? They're so all over the place. Well, if you change their environment, if you change their acid and base environment, then some of them don't like to grow. But others that maybe aren't that helpful for you, they start growing more. And so what happens is you can develop bad infections, clostridial infections. In fact, a case of someone who I saw, she was, nice lady, really sweet, history of, arthritis. Was given prescription medication, non-steroidal anti-inflammatory. That time it was Celebrex. And she was given a lot of it. Pain got better. But she started taking, but then it started not to work that well. So she took a little bit extra Motrin, and eventually she wound up in the hospital because she noted that she was very weak and she had some blood in her stool. And she had a major bleed. The good news is she was caught in time. She came to the ER. We helped her. No, I wasn't there, but we helped her. And we also did something that's very normal to give to someone who has an ulcer. She was given high doses of H2 blockers. So which is fine. It's fine. She was given that. It was appropriate. And then she went home and she got better, and maybe about 2 months later she developed a sinus infection. So she got a sinus infection and she was treated with an antibiotic. And after the treatment of the antibiotic, and she was given Augmentin, which is a beta-lactam and amoxicillin together to make it a sort of stronger antibiotic. So then what happened? Within 1 day, she had profuse diarrhea. So she had a Clostridial difficile infection. And it was very difficult to control. And in fact, she could not control it. They tried to give her antibiotics again to treat that infection, and it could not be controlled. She came to see us, and we luckily got her very high dose probiotics, and we were able to actually get her what's called a fecal transplant. which I'm sure some of you have heard, and a fecal transplant, which is the only indication for fecal transplant, is C. diff infection. What's interesting enough about fecal transplant is the people that have gotten fecal transplants because of C. diff, that depending on how the gut of the person or the body type of the person that they got their transplant from, interesting enough, some of them did some weird stuff. Like some of them that got this transplant that were obese to start and got a transplant from a thin individual, guess what happened? Whoever answers gets a gold star, and then you get on the video and maybe you become a star. And
Lost weight.
they lost weight. They lost weight, and guess what? Did they change their diet?
Not at all.
Not at all. So interesting enough, this was then done by a mice study as well. And you know, mice like to eat the poop of their fellows. It's kind of, you know, anyway, but they do. And if you put, that's a good line, but I'm trying not to address hecklers in the room. I'm going to really do that. So interesting enough, the thin mouse, the heavy mouse ate the poop of the thin mouse, and the heavy mouse got thinner, didn't change its diet. Interesting enough about that population of sterile mice is that they could not gain weight. So they couldn't gain weight. Didn't matter how much they ate all the time. Nervous eaters, continuous eating. They were unbelievably thin. When they were given a transplant from a thin mouse, their weight actually still grew about 20%. When they were given the same from an obese mouse, it grew about 50%. So again, no change, and they actually ate less. So this is just more information.
They made it proportional.
They did. So let me just talk about Lyme disease, since that's what you're here for. So Lyme is a stealth invader. Like we spoke about with the food poisoning, Lyme does the opposite. So Borrelia burgdorferi is a really complex bacteria. It's really an amazing bacteria. So it tends to get into your body, and it grows as slow as anywhere from 12 hours to as slow as 72 hours. That's a problem. The problem is that your body doesn't know what's going on. And that's why it's called a stealth invader. Unlike a urinary tract infection or a food poisoning or strep throat, within a day or two, you're feeling symptoms. So it's stealth because it doesn't particularly like anywhere in the body to go except where it can evade the host. So it has a slow impact on the immune system. I remember what I talked about. When you don't address it right away, if you don't know that you got infected, then it slowly can go and inhabit itself in your joints, in your heart, in your gut, in your brain. And since it's such a slow-growing bacteria, the symptoms are every symptom. And the review of systems that we would check to see, well, do you have any problems with your eyes? Yeah, I get some blurred vision. What's your head look like? How do you feel? I have this pressure feeling. I have this brain fog. And then I have maybe this piercing headache. I got some ringing in my ears. I get some dizziness, vertigo. I got some chest pain too. What's that about? I feel air hunger or shortness of breath. My gut hurts. Oh yeah, and my joints. But it's not only my joint, but like one day my joint and my left hurts, and the next day the right hurts, and then it's my arm. It keeps moving. It keeps trying to evade where it can be found. So it stifles the immune system over time. So there is a significant relationship between the interaction of the intestinal microbiota and the immune system. So we've all heard, I hope you've heard about the gene theory. Gene theory is a pretty amazing accomplishment. It was an internationally done concept of trying to sequence the human genome. It started actually in 1990. It was completed in 2003. Vast amount of information on 27,000 genes that are located in us. The problem is that when they got the gene theory and they developed all these sequences, it seemed that there was a link missing. Like, why is it that if I cut off my small intestines, it's not good, but if I have to do it, cut them all off. Within about 6 months, your large intestines, they start becoming small intestines. They start functioning just like a small intestine. And yet there is no real DNA sequencing that tells that that should happen. So when we look at the microbiome, and I'm going to put this together, the microbiome, we talked about 27,000 genes. When you put together the microbiome, you're talking about 100 times that amount of genomic expression. And so that same mouse, the sterile mouse, when it cut the small intestines, it died. When we populated a full microbiotic flora, it knew what to do. So the bugs aren't always there to hurt you. So protect and restore. We have to understand how our current medical practices alter the microbiome. The indiscriminate use of H2 blockers, of proton pump inhibitors, of steroids for inflammatory diseases, they're important. All this is important. Antibiotics are necessary. We use them all the time. But there has to be a judicious use of how to use them. And the understanding that the microbiome is a very significant part of your organ. In fact, Dr. Gordon believes that's a separate organ system in itself. And we look at restoring. We use the use of probiotics to restore natural colonization, and then there's food. And food is medicine. So this is one of my favorite topics. No, it's not. But it's the gut protocol is really when we see someone in our office, the first thing we do is food and your gut. So we look at what you eat, and we look at how your gut microbiome may be. And we actually typically, unless you're acutely ill, we typically do not start treatment until we know that you're going to be able to handle it. So for us, probiotics are key. And butyrate, which is a small chain carbon, it's a small chain fatty acid. It's only 4 carbons. It's very important for the growth of some of these really healthy bacteria. And some of the things that favors sort of this butyrate are some of the foods that some of you really like, which is fermented vegetables really are great for that. So we use also, when you can't get it in this way fast enough, we go the other way. And the other way is that we have the use of enemas, which can be very, very helpful. And what we know is that it takes about 36 feet to get to where we want orally, and it only takes 1 to 2 feet going the other way. And basically, we use very high doses. So we don't mess around. So if you think about it, if you've got 50 to 75 trillion units of bacteria in your gut, and when you go to the health food store and you're buying a 1 billion unit probiotic, that's not even a drop in the toilet. That's it. So we treat, and this isn't a cliche because this is really what's necessary. We treat you. We treat the whole person. We have to, because this disease affects the whole person. And the tragedy of not being treated or being misdiagnosed or giving misinformation, unfortunately, I see every day. And to me, that's what drives me to inform. And what I'm going to tell you is whatever you get out of this lecture, make sure you inform your physician, because we don't learn this. We are not educated on nutrition. You know how much nutrition I got? I went to a great school, went to Mount Sinai, great school. Mount Sinai, basically it's the national headquarters for irritable bowel issues. 1 week of nutrition. Now, was it real nutrition? No, it wasn't. It was actually parenteral nutrition. That's what you give in an IV. Now, last thing I knew, I mean, you can't really suck down the IV to take it, so it's, it's helpful for hospitalized patients or very ill patients, but certainly useless for everything else. That was it. Biochemistry was based on pharmacology biochemistry, not nutritional biochemistry, and that's really what's needed. So the integration of nutrition and food sciences into the medical field is what's needed. My cousin's daughter has Crohn's disease. She had it since she was 7 years old. She's now 27, and they're looking at removing her intestines because she's in such bad shape. Not once, she's from New York City, not once did anyone ever mention food to her. So for her, the idea of food is foreign. For her, she needs more evidence. But she didn't need a lot of evidence to get a lot of the very expensive drugs that have not helped. But food, she needed evidence. There's lots of evidence, but she wasn't given that. So for her belief, it didn't work. You're here to educate the rest of the community and educate your physicians. So we look at craniosacral therapy, especially for people that have cognitive problems, headaches. Typically, craniosacral, you want to look for a practitioner that's trained by the Upledger Institute. Upledger was an osteopathic doctor, but it's one of the more helpful techniques that we've seen for people with sort of cognitive dysfunction, headaches, TMJ problems. Acupuncture is really excellent for the gut. I have a really interesting story. This is a story of a woman who came to us with diverticulitis that was perforated. So diverticulitis is when your large intestines have a little outpotching where the arteries go into. Sometimes if you're constipated or you don't have a great diet, it can outpouch and cause this diverticuli. And sometimes it's bad enough, it can either bleed or cause a leakage of stool into your intestines. She had that micro leakage. We put her on our program of same idea, gut protocol, food, and we had her do acupuncture. And she did acupuncture either once or twice a week. Now, she was scheduled for her operation. She was scheduled 6 weeks out. And, we didn't want to say don't get your operation, but she had completely no symptoms. All her labs were normal. She had her operation. We got the pathology report back. It was a normal intestine. So, to let you know that, look, the system favors procedures and pills. The system doesn't make money on core eatery. So just remember, if you're not given advice, it doesn't mean it's not there. We use supplements, and there are so many supplements that we use. I can use it as sort of questions later, but there's a lot of really good herbal supplements. And now there's the diet. What to do? Ketogenic, paleo, anti-inflammatory. And I'm going to tell you that it really has to be individualized. The fact is because not one diet fits all. I really mean that. Because there are people that are vegans, and it's very hard to put them on a paleo diet. Okay, but anti-inflammatory diet, you can really try to modify. And the ketogenic diet is a very drastic diet. Ketogenic diet, typically for those that have not been familiar with it, but ketogenic diet can be very helpful for some people initially, or if if other treatments have not worked. But the ketogenic diet is basically between 60 to 70% fat. It's about 20% protein and between 5 and 10% of carbohydrates. The fat is good fat. You know, it's healthy fat, omega-3 fat, olive oil, so omega-9, walnut oils, coconut oils, things like that, but it is a very high fat content. So what we can eat? Well, basically, you want to eat like you're fed here, really close to where it's not processed, where you just get it out of the earth. Leafy green vegetables, non-processed grains, proteins, and what I tell people is if it lives well, you can eat it. If it doesn't live well, do not eat it. You would not want to eat a sick animal in the wild. Why would you want to eat a sick animal here? And I have another story about the use of genetically modified foods and antibiotics. It's kind of an interesting story. So this young child came into my emergency room, and she had just eaten a cherry pie. Ate a cherry pie, and she had an anaphylactic reaction. So anaphylactic means she had an acute allergic reaction. Face swelling, asthma. She was very direly ill. So we treated her very acutely. And we, went back, well, what did you eat? What did you do? Anything, any meds, this, and it. Turned out, it seemed all right. I mean, she had a dairy allergy, but not an allergy that would give her this immediate response. Well, so we really couldn't figure it out. Now, the parents were very, very astute and really wanted to make sure that they knew what was going on. So it turns out that they had the cherry pie tested. So what they found out is that the cherries were treated with streptomycin, which is very common. It's a pesticide that's used as an antibiotic. And it turned out that when this child was given a skin test for streptomycin, she had a significant reaction like she was going to have that. So I just want to say that that's why, yes, antibiotics are bad. And in fact, if you want to look at the antibiotic use in the culture, in us, 70 to 80% of it is used in agriculture. So it is a major problem. And the idea of genetically modified foods, we go by the Clean 15 and the Dirty Dozen, and you can look them up. But basically that will give you an idea of what foods you can eat and what foods you should really avoid. But the idea of genetically modified, so like wheat, so wheat and gluten is a real problem because it's so modified. It's not the same wheat that you knew. How am I doing with time? I just want to make sure I'm... Okay, we're good. Okay, all right. Do this in 5 minutes, I hope. All right. So genetically modified grain, why do they do that? Do they do it to make it more healthy? Do they do it to make it richer in nutrients? Come on, I got a heckler. So, yeah, because it's shelf life. Because what they want is to be able to transport it. So if you transport it, they want it to be resistant to funguses and bacteria. So what did we just say about the microbiome? So your body likes stuff that nature likes. So it likes to eat the stuff that nature likes to eat. Well, if you have a genetically modified wheat that nature doesn't know what to do with, and now you've been given this antibiotics that kind of disrupted your microflora, guess what? Your body thinks this is a foreign protein, and it starts reacting to it, just like Lyme disease, circulating immune complexes. So the same kind of thing, and I will tell you that we've had patients that have come in, they've seen me, they said, look, doc, this was a farmer, came in and goes, doc, I don't know, I got bit, I think I got bite, got all this joint pain, all this stuff going on. And he was a farmer, and he didn't eat really well. He was a dairy farmer, and he ate pretty lousy. So we tested him, But before we tested him and before we treated him, we did what we said. We said, look, okay, we're going to give you some probiotics. We're going to really try to get your gut ready so we can give you some treatment if we need to. But we're going to put you on a pretty strict diet. And we're going to figure it out. We're going to work with you with it. So we did. No wheat, no gluten, really healthy grains. And we're going to go over some of that. And we're going to not have you have dairy, which was really shocking to him, right? Because no dairy either. And guess what? He came back a month later. No symptoms. He felt better. I said, well, all right. I'm not going to treat you. I've already treated you. So he was someone that we were able to do that with. Now, that's not saying that we can do that with everyone, but he was, sort of outside the role. This is really cool. My daughter told me about this board. This is great. I want one. So these are the foods that we look at. And what I want to tell you is the stars that you see, those are the ones that sort of have more of a positive power. Meaning sometimes, and some of the books you may have heard of the Singleton diet, which is the one that he does phases. This is the first phase where he'll use only certain foods that you can eat for the first week to try to detoxify you. And so this is some of the approach that we also use, which is coconut oil, ghee, avocados. So these are that. Dairy products we pretty much avoid. Now sometimes we'll say, highly, if they have significant, they've 2-year-old aged cheese or something, so they really fermented a lot, except for people that have headaches. Because if they have headaches, then that's a very high tyramine content, and tyramine is linked to sort of headaches, so we don't do that for them. But again, that's not what they would be. We would tell them for the first week or 2 weeks, you got to stay away from it. But we typically have people stay away from dairy, only because when we do allergy testing, dairy is top. It's one of the top. Dairy and eggs are kind of the top. So chia seeds, flaxseed. Flaxseed is an amazing seed that has what's called enterohepatic circulation. It improves enterohepatic, which means it improves the gut-liver circulation, and it has omega-3s and antioxidants that make it a really great. Artichokes, asparagus, beets, broccoli. So these have very high sulfur contents, which means they stimulate glutathione. Glutathione is one of your natural detoxifying peptides in your liver. Spinach, kale, leeks, all this stuff that forms oxalates. Since my wife is here, she is a stone former, not a stone former like she smokes a lot of pot, but she's a stone former that she forms kidney stones. And so it's really terrible because she can't eat all this stuff because it's all high in oxalates. It's terrible. But we're going to try. We try to flush them out. Spinach is she can't even look at spinach. She forms a stone. It's terrible. And low sugar fruits. All right. Oh, you want that? I'll tell you. I don't know how to do this, and I don't know if it can be done. But if we can. You can get access to this talk. And you don't have to take all these notes and stuff. And so this is information that needs to be out there. And then proteins. So typically, when we're looking at proteins, we typically work with more fish. Now again, it has to be wild fish, as opposed to chicken and other game. But this is kind of that. And so then the things he can't eat. So sugar is really bad. So sugar is bad. That's it. That's all I have to say about sugar. No. So it takes about 3 weeks for your taste buds to actually stop thinking about sugar. And there are actually some really good herbs or supplements that you can take that can reduce some of the cravings for sugar. And I will mention them very, very briefly. Alpha lipoic acid is one of them, and that is a really good supplement. It really helps. Chromium is also another one. Relora, which is a mixture of philodendron and magnolia. So if you want to write those are really good for sugar cravings. And there's even more, but wheat, again, what we spoke about. And then these are some of the non-gluten grains. Buckwheat is probably my favorite. Buckwheat is not a grain. Buckwheat is actually from the rhubarb family. It's one of the lowest glycemic acting of the sort of non-gluten grains. And it's really too bad that it's called buckwheat. I don't know why. Maybe it was from the Little Rascals or something. But anyway, and those of you that know that, we know your age. Okay. And then legumes, and we can, if we have time, we can talk about that. So sweeteners, stevia is great because stevia actually modulates insulin. And then dark chocolate is a medicinal, so we're okay with dark chocolate. So as long as it's above 70%. So this is basically studies that were done looking at rheumatoid arthritis. And people with moderate to severe RA that switched to a low-fat vegan diet had significant reductions. And vegan diet free of gluten improves the signs and symptoms, and the idea is there was a reduction in antibody to food antigens. So if that wasn't enough to make you crazy, this was kind of how to end it. So as you see, this is kind of what we look at as the big picture. We look at your symptoms, we do a physical exam, we get common labs to look at. We look at a bunch of labs, imaging if necessary. We then you enter here. This is how we may treat you. Everyone starts with the gut protocol, which is what we spoke about. And then if you're not getting better, so you're 0% better, then we look at kind of restoring you, right? You're not getting better. If you're only 50%, we may then repeat the round. If you're 100%, you get a diploma. It's really nice. We have a whole ceremony. It's really amazing. And what I want to show you about this is really, if you want to think about it, these are balloons. This is the best. So support is what everybody, oops, wait, did I mess it up? There you go. So support is what everyone needs, right? Because this is a devastating disease, and it really can be. So spiritual connections, the love of your family, the love of your partner, support with that, being able to speak to people. It improves resilience. It improves the outcomes that we see. Care for someone else. If you're sick, care for someone else. It really does help. The gut protocol, generate good bacteria, increase your immune function, improve treatment results. Nutrition, supplements, enhances your body's natural function. It's basically a lifestyle change. Food is medicine, and movement is medicine. Those are the best medicine out there. Non-pharmaceutical ally to fight against bacteria. And I have to tell you, what does drag you down is the prescription medications and the antibiotics. So they have to be done very judiciously, very carefully, and controlled. We look at short-term attack for long-term efficacy. We target specific bacteria to kill the bugs. And that is it. So thank you very much for your attention.
Okay.
All right, we have some time.
Yeah, okay, well, listen, no one's going to like this, but we have another group in 5 minutes.
Okay.
So here's what I'm thinking. Yeah, so listen, from a question standpoint, if you guys go out and and give your questions to Margaret, we'll get answers to your questions back to you. The other thing is that if you all want the PowerPoint, I think all of you signed up, so I think we have your email. I'll forward you the whole PowerPoint, okay? So, yeah, this is one last quick thing. So we started this restaurant, and my background actually is very similar. I'm a physical therapist and did a fellowship in nutrition and metabolic medicine in this functional medicine world. And so we have this tagline, change your lunch, change your life. That's like our tag, and like your lecture, like it just really speaks to really what we're in a different, you're in the medical world speaking this, and we're in like the food world, saying, listen, if you don't change how you think about eating and you don't have access to food that's sort of like this, it's hard to be healthy. So we appreciate you coming. If you're interested in more, I think we have your names, and so now you'll get little notices on what we're talking about. So if you guys could get out of here, we got our next group coming in. Thank you, guys. Thank you, Dr. Stram.